am from the Center of Nutrition from the Sentinel Site Surveillance Unit. Today, I would be presenting the National Nutrition Sentinel Surveillance, which has already been approved at a meeting at La Plaza Hotel previously. And today I would explain to you about the results of this research and also explain to you some of the key findings. So this is my presentation outline, which I will start with the elements of the survey, then follow with the objectives, and lastly with the survey findings for the second round of the nutrition sentinel surveillance. Now here is the elements of the survey, which we will focus on the nutrition status among children under the age of 5, nutrition status among women of reproductive age group, food insecurity, and WASH. The objectives of this study is to monitor trends in nutrition of the population and look at the trends of the nutrition in high-risk group and high-risk area, and this will be used to generate evidence and also other corrective measures, in particular in high-risk area. In terms of the target population, we selected household with children at the age of 6 to 59 months, and also households with mothers with children. So any household with children without mothers will be excluded from this survey. So we will monitor their the food from both the mothers and children, and the target provinces cover all 18 provinces. We use a systematic random sampling. The sample size was 1,500 households. In some province, we select 2 districts, and some province we select 6 districts. It depends on the size of the province. So altogether, we have 75 sentinel sites in 18 provinces. Now, in some district, we might select 1 village, or some district we might select 2 villages. In each village, we collect 20 samples, which equals to 20 households. And this is the result after collecting the data. So for the trend of malnutrition among children under the age of from 6 to 59 months, so this is quite an alarming statistic. You can see that from this graph with the latest information, we see that most of these malnutrition data, such as stunting, underweight, wasting, remain the same up until from October 2022 to October 2023. There's not much change since then. Now, for the nutrition status of women of reproductive age group from March 2022 to October 2023, we see that the malnutrition also remains mostly the same, and the obesity remains about 3% and overweight at about 17%. Now for breastfeeding, especially here is the percentage of children receive breast milk within 1 hour of birth. You can see that the data only shows 66% of children receive breastfeeding, and 76% of this number, 76% is in the north, and 54% in central, and 66% in the south. Now, this is the number of children which receive exclusive breastfeeding up to 6 months. The number only shows 67% of children receive exclusive breastfeeding for the first 6 months. And of this number, 78 is in the north, 59 in the central, and 60% in the south. Now, the children who receive breastfeeding exclusively up to 2 years, the number dropped from 73 to 51 from March 2023 to October of the same year. So you can see that there's a drop in the numbers of exclusive breastfeeding up to 2 years of children. Now, the percentage of children who receive diverse group of foods, you can see from different indicators such as MMF, MDD, MAD. You can see that there's a slight increase in MMF after the harvest season in this age group. But however, the number of MMF is only 70%. And of which the North show the highest improved, which is 79%. Now, in terms of MDD, the total data is 52%, and the same, the North show the highest number at 55% for MDD. Now, for MAD for children, the data only show 30% on receive minimum acceptable diet, and of which, again, the North and the South show the highest number of MAD, while the Central comes last at 24%. Next, this is the supplementation of vitamin A among children 6 to 59 months. So initially, we set the target of more than 80%, but the data show only 63% of children receive vitamin A supplementation, and of which the North only managed to get 77%, still below the threshold, and followed by 60% central level and 43% in the South. Now with regards to access to drinking water, you can see that the basic access is 66%, and only 3% that shows the limited access to drinking water by some households, and 26% use unimproved water source as their drinking water. Now, for sanitation, only 83% of the household can access or have basic sanitation, and 5% have limited access to sanitation, and 1% use an unimproved methods for sanitation. And we can see that about 11% still show the number of open defecations, which is quite a concern for us because this could be the source of various disease. And for hygiene, we see that from the data that we survey, 29% have access to basic hygiene, and 1% have limited access to hygiene facility. And 30% has no access to hygiene facility, and this usually means, hand washings, sinks. So, and here is the percentage of children with diarrhea in the last 2 weeks. So we found that 10% of children were affected by diarrhea, and the north covered 12% of these children, and the central and south comes at 8% each. Now, for the food security, and you can show that the number of food consumption score, the acceptable rate is usually at 88% for the central and north 94%. But now let's take a look at the percentage of food-based coping strategies. From the household we surveyed, they did not have any strategies to cope with food insecurity. And what would they do if there is any food shortage in their household? And we also have percentage of livelihood coping strategies. For example, when there's a disaster or some form of crisis, what would they act or do? There's currently a lot of people do not have coping strategies. Usually people respond to the crisis or the disaster once it occurs. There's no strategy put in place before those crises or disasters. So more than 80% do not have coping strategies for their livelihood. And we also take a look at the food expenditure share, and in this study, we found that the population that we surveyed, the majority of them have created food expenditure share, and which is more than 75%, and in of which you can see that South come at the top. Now for food security, access to safe food, you can see that the majority of them have access to food, but the actual real food security is only at 26%, but the majority of them are in the marginally food secure group. After this study, we made some recommendations to improve future corporations and future actions and measures, especially to improve the nutrition status and breastfeeding. So number one, there's a need to work together with various sectors and to address the nutrition issue from different angle as well. So that is the collaboration between health, education, agriculture and forestry, and also other social sectors. We also need to increase the awareness on breastfeeding for children, especially to promote exclusive breastfeeding after birth, and to continue to provide breastfeeding up to 2 years, and may additionally supplement with some food. We also need to develop strategies to ensure food security for women and children, to promote minimum dietary diversity. We also need to raise awareness on nutrition and food intakes, in particular among women and those who take care of children, and promote balance and diverse nutrition and food groups. And also we should create awareness about reducing the consumption of unhealthy foods. Now for WASH, we need to invest in basic infrastructure for water system, hygiene and sanitation, and to create a public education on safe drinking water and proper use of latrines, and to provide capacity building for WASH program and monitor the result and improve on based on the findings we receive. And so nutrition and WASH are the two components that need to go hand in hand. Now the last recommendation is related to food security. We need to implement the program on diverse food group and dietary for women and children, because this is a chronic issue that cannot be solved by just one sector. So health, agriculture and forestry, and education and other sectors need to work in collaboration to address the issue of food security, and this because this is a cross-cutting issue that need to be addressed together systematically. So that's some of the recommendations that we made based on the findings of the second round nutrition sentinel surveillance. And at the moment, we are going to conduct the first round of the nutrition sentinel surveillance for 2024. We are aiming to complete the data collection by the end of April and no longer than May. So that's the latest update from us. And on that note, I would like to thank everyone for your attention. And I would like to conclude my presentation. Thank you. Thank you, Dr. Souphaxay. In the chat box, Ms. Lewis sent 2 questions. The first one, what is the percentage of women whose BMI is within normal limits? And the second question, how does vitamin A supplementation compare with immunization, since vitamin A is usually given once a year during immunization? Can you clarify these 2 questions, please? Thank you very much. For BMI for mothers, we did not calculate this time. We only calculate the height compared to weight and weight compared to age. So we did not use BMI for this study. For second question, vitamin A supplementation compared with immunizations. Well, actually, our population are from the age of 6 to 59 months. So there are children who receive vitamin A once and those that receive twice. So the comparison with immunization is not quite appropriate. I understand that the immunization, team would bring vitamin A for them, and because they want to make sure that vitamin A and immunization program, goes hand in hand to achieve 90% for both. But I believe that earlier this year, we had a shortage of some of the immunization, and so we cannot provide immunization for all children. So you cannot compare the two. Now, let me ask you, for your sentinel surveillance, we conduct this sentinel surveillance every year for quite a number of years now. So is there any plan from the nutrition sector to provide capacity building to other government agencies who might be able to help us with the promotion of nutrition action plan? Or because I believe that the other projects or other program that I know, they also provide capacity building for other government officials at the provincial and district level. So I want to know if the nutrition center has any plan to provide capacity building to other agency instead of the nutrition center going directly to work with the communities. Yes, actually the nutrition center works with the Department of Hygiene and Health Promotion and the Department of Planning to develop a data collection system. We call it well child system, and with which we collect the information of children under the age of 5. And the nutrition center provided some training to the provincial and district level. And for the health center, the district and the provincial team will provide the training for them. And we also send a team to evaluate them. At the same time, they collect information and provide it to the database so we could collect the prevalence of malnutrition in the area. And we also educated them on how to calculate the ratio of stunting and wasting. And previously, the team at the local also use the criteria that we teach them to calculate the ratio of stunting and wasting. And each month, they would be able to calculate the number of malnutrition children, and they can consolidate the number for the annual figures. Now, in the past, there are some provinces who asked to do the sentinel surveillance in their province and using the questionnaire that we developed because they received some funding support from their side. We received question from Jan Satit. I don't quite understand what Dr. Jan Satit mean. Can you open the mic and explain and clarify what you mean here?
โดยสบายดี
Yes, good morning.
โดยอันนี้เป็นจันทร์สถิตจากคณะสาธาร
Jan
ณสุข
Satit speaking.
เพราะว่าตอนยอดจากคำถามของดร. เนาะก็คิด
Based on what
เพิ่นอยากรู้
Dr.
normal
Lewis has asked, I think
ของ
what
device
Dr.
ที่
Lewis
คั
want
ด
to
ออก
know
จำกัด
is
อยู่บ่แม่นเรียกว่าอิงใส่เกณฑ์ ratio บ่หรือ
the
ว่า
cut-off point for normal women's, BMI in Laos. I think that's what her question was referring to. Do you understand, Jan Pasit? For maybe you did not use the BMI cut-off point for this nutrition surveillance. But usually for BMI cut-off point, we have, Thai BMI and Asia and WHO. Yes, for BMI, for the nutrition sector, we follow WHO BMI cutoff points for our research. So that's the basis for this study. But this is for women's, right? But for anthropas, it's for 6 months to 59 months. But for women's, it should be an adult group. So I don't know if you use WHO, which is 18.5 to 24.9 or 22.9, cutoff point. We use WHO 18.5 to 24.9 as our base. Any other question or feedbacks? Doesn't have to be a question. If you have any feedback, please feel free. Sai Visain here. I'm very pleased to be able to join this webinar and congratulations for your research and findings. Do you have plan to compare the statistics between different seasons? I myself am doing a study in my department as well, and one of the data that I lack is the malnutrition data at school. And I look at the data from ALSIS, and what I can see is that the access to water or wash, that we receive quite a high score, which is contradicting to what you are presenting today, which show a high number of limited access or no access to water and latrine. And lastly, how do you measure the height and weight of children to come up with the numbers of stunting and wasting? Because back then in 2018, we report 33%, but 33% are the moderate numbers. But if we add the numbers of moderate and severe stunting and wasting, it would be more than 40%. So your report is just a separate number for each of these indicators or combined. Let me answer the last question first, how to calculate this malnutrition data. Actually, when we do the surveillance study, we did not use the samples from the province. So what I mean is that this sample cannot be representative of the province. This number would be just a trend for the entire country. For example, this month in April, and maybe this is the planting season, and then we do after post-harvest season. Now, for comparison, now for the height weight, we measures, moderate and severe malnutrition. Now, with the comparison with previous data, I just want to inform you that previously we only have 36 sentinel sites, which means only 2 sentinel sites per province. But in the latest round, we have 75 sentinel sites, and some province would receive more than 2 sentinel sites, and some district would receive more than 1 or 2 villages. So in this round of survey, we found a lot of challenges in terms of data comparison. So if you're going to compare the data, you need to compare the data that we collect from the same set of sentinel sites. And with regards to the point of with the point you mentioned about the number of ALSIS and the sentinel site, you cannot compare the two, because ALSIS is a national survey. And our sentinel site is just a small scale survey, so you cannot compare the two. This survey is meant to just study the trend of malnutrition. And lastly, your question about malnutrition in school, we didn't develop any particular questionnaire related to malnutrition in school, because when we conduct the survey, we actually visit the community, and that means we ask in the household. So we did not visit the school and measure the malnutrition in school. I don't know if I answer your question. Souphaxay, I think he asked if you had compared the data between the dry and rainy season. Yes, we do compare In the first two rounds, we also compare the data for dry and rainy season. But in this round, we cannot compare with the previous round or first round because the first round, the number of sentinel site was only 36 and this one is 75. So you cannot compare the two. So you increase the sample size essentially or the sentinel size this round, this time. Yes, that's right. Dr. Saivisain, was that clear to you or you have other question? I don't have any recommendation in particular because when I work in North District, I saw how the team try to collect the data and this had a lot of challenge. But especially in the villages where we work with them, we want them to monitor the trend of the malnutrition and the team had a hard time to monitor and follow up with this data. And then back then when I worked in North District, we visited them every quarter to collect the data, but still, when I look at your data here from the Sentinel surveillance, there's a lot of discrepancy between my data and your data, but I think it depends on the location you selected for this survey. And for the school data, I think it might be because of your assumption and you develop this survey in a way that you would collect data only from the households but it doesn't really tell a story about the school. So because it's a entirely different story between the household and the school. So I think we need to conduct another survey that would help us to monitor at the individual level or maybe from a different group of population. And the other thing I think is important is that we need to be able to monitor data from the same sentinel sites. And we should also include other social statistics in our study so that we can make more linkage between this study and the ALSIS study. Souphaxay, I have a question. So if we want to conduct a survey in schools, for example, if we visit a village where, there might be some schools in that village, is it possible to include a survey in the school? Well, the target group is 6 to 59 months. They are not in school yet. No, well, for the next round, maybe we add the funding and we expand the survey to the school and we do not limit the scope to the household so we can increase the number of samples to the school. I think it's possible, but we need to consult with the committee and the donor and see how they feel about this. But I just want to add to what Dr. Saivisain mentioned. We also share a similar idea to monitor at the individual level, which we are doing in the 4 provinces in the north. We monitor from the day they were born to the up until the age of 5, but that was only 4 provinces in the north. But using the tracker and ID, it's quite difficult. But this year we discussed with WHO, we are going to do a tracker system at the provincial level, not at the district or health center level, and we will see how much money we are going to need for that, and then we will see the feedback from the first round, and maybe sometime in May, June, we'll start to pilot this system. Yeah, of course, we want to use a tracker system to monitor children from the individual level, from the day they was born up until the age of 5. Just want to add one thing, because just a few days ago, I visit the National University of Laos. The team at the National University, they visit some province. They visit the family registration book, and normally the family registration book and the pink booklet and the ID are the same thing, but the doctors, they separate the duties and tasks, and they put the data into these different identification papers differently, and they made a mistake. But usually these 3 documents, they should all have the same information. And when we cannot use the tracker for our study, then we cannot really see the difference, the change, and the trends of that children. I think the health sector did quite well in Nor District when they used the pink booklet to record the birth of children. But I think after the program ends, I don't think a lot of people continue to use that system. But I think we can start with, implementing the use of the pink booklet to record the birth, and not just to record the immunization. I agree with Saivisain, because in my village, they also conducting the action plan to record the death and birth in my village. And when they collect this information, they really didn't care about the height or the weight of the population, because these are people from the Ministry of Home Affairs, and they do not really care about the height and weight. And if we continue to do so, we would not have the data that we need, or the data that would be useful for us. But I find it very difficult to talk to them, because they are from different line of ministry and having different point of view. But I think it would be very useful if we can ensure that everyone has the same practice on how to record the data. Dr. Latiporn, we are discussing about the convergence approach, education, health, agriculture. But convergence is not limited to just 3 sectors. Last time during the meeting, I also talked about rural development, road infrastructure, which is, public works. Now we know that, other ministries such as national defense and public security also work on this issue as well. But I think nowadays more people understand that this is an issue that not just 2 or 3 sectors can do or overcome. Yeah, that's right. And I think people understand that we need to involve more than one sector. Dr. Chansatit, you raise your hand. Thank you. I review your presentation slide, and you mentioned about MDD, and for 6 to 23 months, but I am more interested in the data for the 24 to 59 months. Do you have the numbers of MDD for this group and how do you calculate this? Because I understand you study children from the age of 6 to 59 months. Yes, I'm talking about this slide. Yeah, you show the numbers of children 6 to 23 months, but I'm interested in the other group, which is 24 to 59 months. Did you take a look at the dietary diversity consumption for the children in that group? Or do you have the data, but you have not calculated and shown to us? The slide you're seeing, yes, it's 6 to 23 months. But for 24 to 59 months, we did not calculate. We want to focus on the children under the age of 2. But if I want to see the data from those groups, do you use 7 food groups to calculate for those students? There are food for mothers and food for children. I don't know if it's 10 or 8 for women's food group for women. So these data exclude the data from that group. So you only calculate the food diversity consumption for this group and not the other. Okay, thank you. I would like to add to what Dr. Jansatit has just said. At the moment, we are changing trend. It's not children under the age of 2. We are now moving towards under the age of 5. In Thailand, they also develop guidelines for this. And in the research, we are seeing the same thing, which is that the children under the age of 2, if they follow the guideline, which is to be breastfed by mothers, there would be no problem. But after two years, they would start to consume regular food. And a lot of time, parents start to assume that children from this age can have the meal on their own. So maybe in your next survey, you can focus on the children under the age of 5. Thank you, Dr. Sai Vicen. That's interesting. We will consider that and discuss with our supervisor. My name is Kon Hearn. I would like to ask Dr. Souphaxay. At the moment, I am working with Mahidol University in Thailand. And there is a doctor who's working on the trends, especially behavior change, and they share some information with me about behavior change. So I was wondering if it's possible to collaborate with Mahidol University in Thailand by developing a project proposal to work with them. Would that be possible? You mean about social behavior change? Yes, but the data I received from Mahidol University is about the use of certain activities to create change for the entire community. And they would also follow and monitor other indicators such as malnutrition, which is a study that would allow you to see the changes in the trends. And the project duration is 7 years. So I was thinking when we conduct this, you conduct survey now 2 to 3 times already. I would like you to Well, there are a couple of projects who did this kind of survey. So I have this idea that, because we have University of Mahidol who is already working with us, and the nutrition sitter is the focal point in Laos for all things nutrition. And you understand that this is not a task you can do alone. And I would like to suggest that, we can use the knowledge we gain from the Princess of Thailand project and combine that with the work that we are currently doing, or create a new project and develop some sort of new model so that the professor in Thailand can be our mentors. Would that be something possible? Souphaxay, let me answer that for you. I think ANRCB received support from a couple of agencies and to work with Mahidol to improve the coordination for nutrition, and Mahidol want to do MOA with us. And at the moment, University of Health Science and Nutrition Center are doing MOA to collaborate and work together within that framework. So I would like to ask Souphaxay you to talk with the head of nutrition that with the current MOA that we have with Mahidol, is there anything we can add into this scope? And there are also other project called Trika, which is Lao and Thai project under the funding support from the Princess of Thailand. And if you create, a proposal project gearing toward this MOA or collaboration, then we can get the support from Thailand and Mahidol University. And Dr. Kitti, last time when he visited Laos, he also mentioned about this MOA. I think you would Dr. Kitti would understand this very well. You can discuss with them because they're currently waiting for the MOA. Sorry to interrupt you. Actually, SBC is a project that we are currently doing under the support of the World Bank Group, but it is the responsibility of the Department of Information and Technology, in health information. But if we are going to do that, it would be a duplication of effort. And actually, I know they have a couple of activities that they're doing. I believe that it is a good thing to do, but we need to coordinate with the Department of Health Information. Otherwise, there would be some overlapping of efforts. But in the past, we have worked with them, and I also took part as a trainer in some of their courses as well. Thank you, Dr. Souphaxay. The reason I asked this because in this afternoon, Mahidol University asked to for a virtual call with me because I used to do a survey with them 2 years ago, and currently the professor at Mahidol University would like to write an abstract about that project, and they want the nutrition center to mobilize the funding to extend the survey and to extend the activities. And in this afternoon at about 3 p.m., I will talk with that professor to discuss about writing the paper on iodine supplements. And second, I would like to ask him to collaborate on SBC project proposal development and do some sort of capacity building that is multi-sectoral project, and also want to share the model I've learned with them and use that model to develop a new project, maybe under the MOA framework, to use this to work with them. And we also have the funding support from the Mekong project. Which covers work with other sectors such as education and agriculture. So I was wondering if it's possible that we develop some kind of project with them. Kwan Hyun, you can update to Mahidol, that university that the head of the nutrition has visited with the team at Mahidol, and they're going to sign MOA. And you can also tell them that currently in Laos, the international organization and the government agencies are going to do a survey on micronutrients, and that is a survey we haven't done for a while, to collect the data that would be useful for various symptoms such as anemia. And tomorrow some of the team would also visit Cambodia to study and observe the research conducted in Cambodia. And if the university in Thailand is interested to work with us, they can work with us or other agency in Laos who are working with various sector in various agency under the health sector. Thank you. And there's a question about double burden of malnutrition. Souphaxay, did you not talk about the obesity or overweight, right? Yeah, that's right. Is there any other questions? Dr. Ponsavan, are you still with us? Souphaxay, would you like to conclude, summarize, because there's no more question? If there's no more question, I would like to thank everyone for joining us in this webinar today. And thank you for listening to the findings for this second round survey of the nutrition surveillance for 2023. If you're interested in any information you've listened today, we are more than happy to share the PowerPoint slides. And we are going to do the first round of nutrition surveillance for 2024 in the coming months, and we can then see the comparison between 2023 and 2024 of the same period. And this time we're going to use the same household, meaning the same sentinel sites. So on that note, on behalf of the Nutrition Center, I would like to thank everyone once again for taking your time to attend this webinar, to listen to this finding. I wish everyone good health and happiness in the coming Lao New Year's. I wish you and your family a lot of happiness and success. Thank you. Yes, thank you everyone for joining us, and thank you to the interpreter. If you would like to watch this again, you can watch this on YouTube, and all of the feedbacks and the question we received today, we will discuss about these questions and also your suggestion with the team. Thank you, Souphaxay, and everyone for your cooperation. And now, ladies and gentlemen, that's the end of our webinar today. Thank you and goodbye.